That is a tough one, but there has been a lot of progress. So I remember a few years ago when Tim Lay and others presented the genetics of acute myeloid leukemia, and there's been a gradual evolution. So I actually went to a scientific committee meeting where Tim Lay, the same speaker that originally broached this subject at ASH a few years ago, showed the increasing complexity of the interpretation of data. There's been a lot of progress in the genetics of AML. So now, rather than focusing on one or another mutations, he's looking at the entire sort of symphony of mutations. That is, these patients who have 5 or 6 mutations, instead of just trying to identify which is the driving mutation, we now know that it's a coordinated effort by the combination of mutations, and we're looking more and more at how they interact with each other. One of the plenary sessions talks was about one of the mutations that we see commonly called DNMT3A, which we thought affected just epigenetics. But what has been found is it actually affects multiple factors, including epigenetics, also spliceozymes, and how it interacts with spliceozyme mutations. So we're understanding better from a physiologic point of view how 2 different mutations combine to cause leukemia and how that affects the response to treatment. So there's been a lot of evolution. Things have gradually evolved in some places, and then there's better understanding of what causes relapse. So there's been presentations here showing that many of the relapsed leukemias, in which we thought mutations evolve with time, those mutations were actually there to begin with, but chemotherapy pressures selected out the most resistant leukemias. And there's also been some presentations at this meeting that have showed how epigenetic changes in the methylation of cells actually impacts relapse without any change in genetics. So it's clearly evolving. People are getting better at the technical aspects, and we're understanding the biology more and more as time goes on, which will eventually have a huge impact on how we treat leukemia.